Hey guys, today we're going to be covering Pharmacology and Medication Administration, Chapter 14 in your book. Alright, in this book we're going to be going over how do we administer medications, medications that an EMT that you will be administering, how names are formed, the forms of different medications, as well as the routes. How do we give the medications themselves? We'll also go over some essential information that you need to know about medication. How do we reassess following administration of a medication, as well as key steps and sources that you can for not only administering medications, but if you have any information that you need to get about medicines that you don't know about. During this lesson, you'll learn about assessment emergency care for a patient whose condition may require administration of a medication. As an EMT, you will be responsible for administering or assisting the patient with the administration of certain medications. Unlike a mathematician, you cannot erase your mistakes and start over. Once a medication has been administered, you cannot extract it or prevent its effects. So, a medication is generally defined as a drug or other substance that is used as a remedy for illness. A drug is a chemical substance that is used to treat or prevent a disease or condition. The terms drug and medication are often used interchangeably by EMTs. The study of drugs is referred to as pharmacology. And used properly, the drugs that we can't give can dramatically improve a patient's condition. However, used inappropriately, drugs can have serious adverse effects. Now, you can only administer drugs that are in your scope of practice, no matter what level of EMT you are, and that have been ordered to be administered by a licensed physician. So, aspirin, for example, that we give as part of our chest pain protocol. The purpose of it is to help relieve blockage within the heart or within the body. So now, it does not bust clots. It just prevents further coagulation. Nitroglycerin, for another example. We give this for chest pain. So what it does is if it causes vasodilation, allows the vascular to open up, to now blood flow can flow through, chest pain is now relieved. However, if you use it inappropriately, such as giving too much of it, or giving it to the type of patient that you should not be giving it to, it could potentially cause the patient's blood pressure to drop very drastically and cause them to go into cardiac arrest. When the correct dose is administered appropriately, the patient's condition may improve significantly and uncomfortable symptoms may be relieved. If administered inappropriately, some drugs can cause serious side effects and deterioration in the patient's condition. If the orders allow EMT medication administration, the EMT will obtain the aspirin and instruct the patient to chew the aspirin, and then the EMT will place the aspirin in the patient's mouth. If the orders allow only patient-assisted medication administration of aspirin, the EMT will obtain the aspirin and instruct the patient to chew the aspirin, and then the EMT will hand the aspirin tablet and have the patient place it into their own mouth. Medications the EMT administers are either carried on the EMS unit or are prescribed for the patient. The prescription medications may be found on the patient or at the scene. It has become more common for EMTs to carry most or all of the medications they're able to administer on the unit. It is extremely important to become completely familiar with your local protocol, as this dictates not only the medications that can be administered, the specific doses and routes, but also which medications the EMT can administer and which are to be patient-assisted administrations. Oxygen, this is an odorless, tasteless, colorless gas that is found in the ambient atmosphere at a concentration of approximately 21%. When it is used for medical purposes, it is administered as a 100% compressed gas concentration. By increasing the oxygen concentration breathed in by the patient, you attempt to put a higher concentration of oxygen into the alveoli of the lungs. By doing so, you increase the amount of oxygen crossing over from the alveoli and into the pulmonary capillaries. For these patients, you should give it when they are hypoxic, or if they're just complaining of shortness of breath, if they have an O2 sat less than 94, or if they're just presenting with signs and symptoms of shock or poor perfusion. In healthy individuals, high concentrations of oxygen have been found to reduce cardiac output and left ventricular perfusion, which reduces systemic and coronary artery blood flow. In patients with heart disease, hyperoxia, or high oxygen levels, leads to coronary artery vasoconstriction and a higher coronary artery resistance, thereby reducing coronary artery blood flow to the heart muscle. This can lead to a reduction in cardiac output, cardiac ischemia, and possibly life-threatening cardiac rhythm disturbances. In some conditions, such as ischemic stroke, in which a cerebral artery is blocked in the brain, or an acute coronary syndrome involving coronary artery blockage in the heart, administration of oxygen when not indicated may actually worsen the tissue damage by an increase in free radical production when the artery is reopened and blood supply reestablished to the once ischemic tissue. In the patient with a medical condition, if the breathing is adequate and their SpO2 is 94% or greater and no other signs of respiratory distress, hypoxia, hypoxemia, or poor perfusion are present, there is no need to administer supplemental oxygen. If their O2 sat is less than 94, or signs of respiratory distress, hypoxia, or poor perfusion are present, initiate oxygen therapy via nasal cannula at 2 liters per minute and titrate to maintain an SpO2 reading of 94% or greater. If signs of severe hypoxia are present, a non-rebreather mask at 15 liters could be used. In the patient with a traumatic injury, especially one involving the brain, thoracic organs, or spinal cord, or one in which there is any evidence of respiratory distress, hypoxia, or poor perfusion, or when the potential exists for significant bleeding or shock, the American College of Surgeons recommends the delivery of a high concentration of oxygen to achieve and maintain an SpO2 of 95% or greater. This is typically achieved through the use of a non-rebreather mask set at 15 liters. If bag valve ventilation is performed on either a medical or a trauma patient, regardless of the condition or injury, a high concentration of supplemental oxygen must be delivered. Oral glucose is absorbed through the mouth and through the intestines and eventually into the blood, where it raises the blood glucose level, making more glucose available to the starving brain cells. The brain cells will once again begin to function normally. This is seen as an improvement in the patient's mental status. Once absorbed with activated charcoal, the poison is carried by the charcoal through the digestive tract and then eliminated in a bowel movement. The efficacy of activated charcoal has been questioned, and it may have harmful effects if aspirated. Activated charcoal has been removed from many protocols. The administration of aspirin helps keep the coronary arteries that deliver blood to the heart from completely closing. EMTs do not administer it for its analgesic or pain relief effects. Inhaled bronchodilators are medications that cause the bronchioles to dilate. They contain beta-2 agonists that are typically deposited through an inhalation route on receptor sites in the bronchial tissue. When the beta-2 receptor sites are stimulated, it causes the smooth muscles to relax, leading to dilation of the bronchiole. This causes a decrease in airway resistance with a resistant increase in airflow and an improvement of oxygen delivery to the distal alveoli. Most often, you will find MDIs prescribed to patients with a history of asthma, emphysema, or chronic bronchitis. These patients have episodes of bronchoconstriction in which the bronchioles in the respiratory tract constrict, increasing the resistance to air flowing into the lungs and down into the alveoli. The patient experiences shortness of breath and signs and symptoms of respiratory difficulty from the increased effort to breathe and from the decreased flow of oxygen to the alveoli. Drugs included that might be given with a metered dose inhaler include albuterol and levolbuterol. With a small volume nebulizer, the indications, actions, side effects, and contraindications of the medication are the same as a metered dose inhaler, only the route of delivery is slightly different. Nitroglycerin is used to treat patients with diseases of the heart that involve partial blockages or spasms of coronary arteries. These medications come as a tablet or spray that is administered under the tongue. Nitroglycerin dilates the blood vessels in the body, causing a reduction in systemic vascular resistance. This reduces the workload of the heart by decreasing the force of contraction necessary to eject the blood against a lower blood pressure in the aorta. The reduced myocardial workload results in a decrease in the heart's muscle demand for oxygen. At the same time, nitroglycerin's vasodilation of the coronary arteries themselves increases the supply of oxygenated blood to the heart muscle. Because the major side effect is hypotension, it's important to measure the blood pressure both before and after administration of nitroglycerin. Another major contraindication for nitroglycerin is to determine whether or not the patient has taken any kind of erectile dysfunction drug, such as Viagra or Cialis. If they have taken any of these medications within 24 to 48 hours, you want to make sure that you do not give it because of the chances of it causing a severe drop in the patient's blood pressure. Epinephrine is what we give for patients who are having severe allergic reactions or anaphylaxis. Epinephrine constricts the vessels through its alpha-1 and alpha-2 effects, thus increasing the blood pressure. Its beta-2 effects dilates the bronchioles, allowing the patient to move more air into the alveoli and decreases capillary permeability, reducing the leakage of fluid. Patients that the basic EMT can give this to has to have their own epinephrine auto-injector that is administered through either the lateral thigh or through the deltoid. Usually the thigh is the easiest one to get to, and it's very easy. All you have to do is pull the covers off, push hard against the muscle, and press the plunger to inject. Naloxone hydrochloride, or Narcan, is what we use for patients that we suspect to have overdosed on opioid or narcotics. Depending on the dose and route of Narcan and the opioid that the patient overdosed on, the opioid may stay in the body longer than the Narcan. Therefore, it may be necessary to repeat the dose of Narcan to continue to reverse the effects of the opioid drug that was taken. In addition, some opioids such as fentanyl or carfentanil are potent and may require several repeat doses of Narcan to reverse the respiratory depression, hypotension, and sedative effects. Narcan itself has no effect on a patient unless an opioid drug is currently in their system. Therefore, it is a relatively safe drug to administer in either suspected or known heroin or other opiate drug overdose. In addition, the EMT can administer it via several routes, whether it be intramuscularly, subcutaneously, or intranasally. Drugs come through a variety of different names, whether it's chemical, generic, trade, or official. The chemical name describes the drug's chemical structure. Now this is usually the first name associated with the drug. I'll show you some examples in just a moment. Generic name, also referred to as the non-proprietary name, still reflects the chemical characteristic of the drug, but in a more shorter form than the full chemical name. It is the name assigned to the drug before it is officially listed and is independent of the manufacturer. The generic name is listed in the U.S. Pharmacopoeia, which is a publication listing all drugs officially approved by the FDA. The trade name, which is also referred to as the brand name, is assigned when the drug is released for commercial distribution. The name is usually short and easy to recall, and may be based on the chemical name or the type of problem it is used to treat. This is the name the manufacturer uses to market the drug. The official name are drugs meeting the requirements of the U.S. Pharmacopoeia or National Formulary are given an official name. There's commonly the generic name followed by the initials USP or NF, such as 1,2,3 propranolol trinitrate. This is nitroglycerin. Okay, the official name is nitroglycerin tablets that has been approved by the FDA, but it goes by the trade name Nitrostat. Now, why do you think it would be important for you to know both an idea of what generic and trade names for drugs are? Right, because you may see a patient that the medication just has the generic name and maybe not the trade name. So you have to have an idea of being able to figure out, excuse me, what medications go to what. Table 14-1 goes over common generic and trade medication names that we may see out in the field, such as nitroglycerin coming in as Nitrostat as a tablet. Nitroglycerin spray, usually it just comes out as nitrolingual spray. Let's see, epinephrine, you might see it as adrenaline, albuterol, Ventolin or ProAir, levobuterol, Zopanex, aspirin, you've got Bayer, Ecotrin, Buffex, there's a bunch of them out there for for aspirin. Now the route of the medication is the way which a medication enters the body. The route by which a medication is given affects how quickly the medication is absorbed into the body to reach its site of action. Routes used by EMTs include sublingual, oral, inhalation, and intramuscular injections. We can also give it subcutaneously, sublingual, which is under the tongue. These medications, we do not swallow sublingual medications. The reason being is it's dissolved and absorbed across the mucous membrane in the mouth. These drugs usually have a very relatively quick absorption rate into the blood, and the patient must be alert in order for you to administer the medication in this manner. We only have a limited number of medications that be given by this route, which would be nitroglycerin tablets or nitroglycerin spray. Oral drugs, these drugs are taken by mouth or swallowed. You'll also see this possibly written staining as PO. Except for activated charcoal, the medication is typically absorbed in the small intestine. This is also known as an enteral route because it uses the digestive system to absorb the medication. The patient must be responsive and able to swallow. Examples of oral medications would be aspirin, oral glucose, and activated charcoal. Inhalation medications are prepared as a gas or aerosol and is inhaled by the patient. This method typically deposits the medication directly to the target site where the effect is most needed. The patient must be spontaneously breathing for this route to be effective. Medications the EMTs administers using the inhalation route would be oxygen metered dose inhalers and small volume nebulizers. In the intramuscular or IM route, the drug is injected into a muscle mass. Absorption is relatively rapid, and this requires the use of a needle. Therefore, it does pose the threat of a needle stick injury to the EMT. Some discomfort may be felt by the patient. Serious side effects might occur if the drug is accidentally injected into a vein. The medication can only be injected in specific muscle groups. Medications the EMT administers by the IM injection route are epinephrine by auto-injector and Narcan by manual syringe and needle. Now, if you're having to draw up the medication and administer it, when you go to place it into the muscle, if you have a syringe and needle, always draw back on the syringe, see if you have blood. If you have blood, you need to pull it out, put a new needle on, and re-stick, because that means you're in a vein. With the auto-injectors, usually the needle's not long enough to go far enough into where you have to worry about injecting into a muscle, or into a vein. With intranasal, the medication is sprayed into one or both nostrils using a specialized delivery device called a mucosal atomizer device, or MAD. That is either attached to a syringe or built into the device. The MAD creates a fine spray of drug particles of a specific size. The fine particles stick to the mucosal lining within the nasal cavity, allowing for fast absorption into the nasal capillaries. The capillaries then deliver the drug directly into the circulatory system. It has been found that this delivery route can produce effects that are sometimes similar to the medication being injected. Medications that you can, as an EMT, can administer using the IN routes are naloxone, using either a syringe and MAD or a Narcan nasal spray, which is a single-use device. A medication administered by a subcutaneous route is injected under the skin into the subcutaneous layer. Subcutaneous injections are designed to produce a slower absorption rate than intramuscular injections. Therefore, subcutaneous administration is not recommended for a medication that must enter the circulatory system rapidly, such as epinephrine in an anaphylactic reaction. The medication the EMT administers using the subcutaneous route is naloxone hydrochloride or Narcan by auto-injector. Medications come in a variety of forms. Usually the forms limit administration to one specific route, such as a tablet, which is a compressed powder that is shaped into a small disc or elongated shape. An example would be aspirin, or nitroglycerin would be another example. You may even have drugs that are in a liquid form. This has no particulate matter. Because epinephrine is injected into the muscle, it's in a liquid form. Before administering any liquid medication, you should always check the fluid. Let me get a pointer. There we go. Check the fluid if you're able to see it, and see if you see any particulates floating within. If you do see any particulates, any floaties within the fluid, you do not need to use that injector. You may also have medications that are in the form of a gel or a viscous, thicky substance that's administered to the patient, such as oral glucose. Suspensions, these are drug particles that are mixed into a suitable liquid. These mixtures do not remain mixed for a long period of time and have a tendency to separate. These must be shaken well prior to administration. An example of a suspension medication would be activated charcoal. Other forms of suspension might be used by metered dose inhalers. This form is actually a crystalline solid that's mixed with liquid to form the suspension. Because it is a suspension, it is necessary to shake the canister vigorously prior to administration. So your metered dose inhalers, you need to shake it very well to make sure it's mixed, and then it delivers a precise measured amount of drug to the patient. Sometimes you might have it where it has a spacer involved with it as well. Same concept, you'll spray the medication, it'll enter into the spacer, and then you just have the patient breathe it in. With small volume nebulizers, these medications are directly deposited on the mucosal lining deep in the respiratory tract. By depositing the medication at the desired site, the effect is more immediate and direct than when given by other routes, and fewer systemic side effects are usually noted. The medication comes packaged in a pre-measured and pre-mixed fixed dose container or inhaler. With these, there will be either a face mask or tube that the patient breathes through. You have a chamber that you place your medication into on either one. You hook your oxygen tubing up to it, set it to your appropriate flow rate. When giving nebulizer treatments, I usually recommend going to about 8 to 10 liters, just enough to get it to where it starts fogging up to administer the medication with. Now obviously if you need more medication, that is fine, but keep in mind the higher you go, these masks are not designed to be at 10, 12, 15 liters. So if you go up too high, you'll actually start popping off your oxygen tubing. So that's why generally with this I would recommend about 8 liters. You'll also find medications in the form of a gas, such as oxygen is one medication that the EMS personnel commonly administers. With oxygen, it's inhaled. It does have some systemic effects on the cells and organs as it's perfused through the body. Another medication that used to be carried, that is also in a gas, is nitrous oxide. It's one medication that was recently been taken out of protocols, but it was something that personnel could use even for pain relief of patients. Spray droplets can be deposited under the tongue. Excuse me. An example of a spray would be nitroglycerin. You commonly see this in the form of tablets, but every now and then you'll also see it in the form of a spray. And each spray that you administer, it delivers a precise metered dose. Now for each medication, there's certain information that you need to know and understand. You need to know exactly what the indications, contraindications, the dose, how you administer it, the actions and side effects of a medication. The indications, this is why we give the medication. These indications are normally geared toward relief of the signs and symptoms or conditions that a patient may be going through. For example, an indication for the use of nitroglycerin is chest pain, because nitroglycerin may potentially relieve the chest pain. Contraindications are situations that we should not be administering the medication. For example, with nitroglycerin, low blood pressure or hypotension would be a contraindication for the use of it, because nitroglycerin lowers their blood pressure, possibly causing an already low blood pressure to become dangerously low. An absolute contraindication indicates that the drug should not be used in this situation or condition under any circumstances, whereas a relative contraindication indicates that the drug is not preferred but can be used if absolutely necessary and no alternative is available. The dose, with this it's important to distinguish between adult dosages and dosages for infants and children, so that the way the correct dose is administered. Too much of the drug could cause potential serious side effects, whereas an inadequate amount of the drug may have little to no effect. For nitroglycerin, EMTs are advised to administer one dose, which would be one tablet or one spray, and repeat it in 3 to 5 minutes if there's no relief, to a maximum of 3 doses, including any doses the patient may already have taken before your arrival. Administration, this is how the route and form in which the drug is given. You, as an EMT, will administer medications either sublingual, orally, inhalation, or injection. Nitroglycerin, for instance, is administered sublingually in tablet or spray form. The action or therapeutic effect and mechanism of action provides the justification for administering a particular medication. If the action described will not produce the desired effect, then the drug should not be administered. Actions of nitroglycerin include relaxation of blood vessels and decreasing workload for the heart. Therapeutic effect is the intended positive response, whereas mechanism of action is how the drug works to create its effect on the body. Side effects. These are actions that may not be desired but could occur in addition to desired therapeutic effects. For example, the desired therapeutic actions of epinephrine are dilation of the bronchioles and constriction of the blood vessels, which help relieve a severe allergic reaction. However, epinephrine can also cause an increased heart rate. This is an undesirable side effect of epinephrine. Another example would be with nitroglycerin, where its therapeutic effect is relief of chest pain. However, side effects of nitroglycerin include lowering of blood pressure, headache, and pulse rate changes. Some of these may be predictable, or you may be unable to predict the side effect that may occur. You also want to follow these steps when administering medication, because these steps are also essential to patient safety. Medication orders may be obtained online or offline. Online orders are verified by repeating them back. When preparing to administer a medication, first thing you need to do is make sure that you have orders from medical control. Either if it's an online order, you need to call them and get orders for it. Offline would be one that you have a standing order and it's within your protocol. Make sure you have the proper medication. Verify that it's the patient's prescription if it's a medication that you're giving from the patient, such as nitroglycerin. And then check the expiration date to make sure that it's still in date. Look for any discoloration or impurities. Verify the correct form, route, and dose. Go through the 5 rights of medication administration, and always document the administration of any medication you give. Restating the drug to be administered, the dose, and the route when receiving an online order reduces the chances that an improper medication is inadvertently administered, the wrong dose is given, or an inappropriate route is used. It may be necessary for the EMT to make a judgment as to whether the patient can tolerate the administration of the medication. For example, you may have received an online order for the administration of oral glucose. The patient was talking incoherently when you called medical direction for the order. However, their mental status has deteriorated, and now they are only responding to painful stimuli. So even though the order exists, it is now inappropriate to administer the oral glucose to this patient. Once the medication order has been received, it is as the EMT's responsibility to ensure that the proper medication has been selected. And keep in mind that many medications have several trade names, so make sure you're using the correct one. When the medication to be given is not carried on the EMS unit and must be obtained from the patient, it is important to verify that the medication is actually prescribed for the patient and not some other individual such as a spouse, relative, or friend. Some patients may take medications that are not specifically prescribed for them. They believe that if the signs and symptoms are similar to those of someone who is taking the medication, then it is appropriate for them to take it. To avoid medication administration errors, it is vital to check the prescription label and verify the patient's name. The EMT should never administer medication that is not prescribed for the patient unless ordered to do so by medical direction. Some medication levels are not affixed to the medication container itself, but are placed on or inside the box or other outer packaging. Nitroglycerin, epinephrine, auto-injectors, and metered-dose inhalers are packaged this way. If your patient has one of these medications, you will not be able to tell by looking at the container if the medication has prescribed for this patient. If the outer packaging cannot be found, you must determine through careful questioning if the prescription truly belongs to the patient. Depending on the type of package and the medication, the expiration date is either printed on the container or on the prescription label. Properly dispose of expired medications according to your state drug or pharmacy guidelines. Epinephrine or any other medication that comes in liquid form should be inspected for any discoloration or cloudiness prior to administration. If the medication appears to be cloudy or discolored, or if any particulate material is found in the container, do not use it. Discard the medication. Some drug packages are similar but contain different doses. For example, the epinephrine auto-injector comes in adult and pediatric sizes. The packages look very similar. Without close inspection, it would be easy to mistake one for the other. Administering an adult dose to a child could have detrimental effects, whereas administering a pediatric dose to an adult may have little to no effect. You then want to go through the 5 rights of the medication. First, you want to make sure that the medication you're administering is prescribed for that specific patient. Do not administer medications that are prescribed for anyone other than the patient unless ordered by the medical direction physician. Be sure that the medication being administered is actually the medication that is intended to be administered. Many patients put several different types of medications into one prescription bottle. The route may be oral, sublingual, inhalation, or intramuscular injection. Administering a drug by the wrong route may have deleterious effects or no effect on the patient. Be sure to understand differences in doses for adults and children. By not knowing the proper dose of the medication, you may underdose the patient, resulting in the medication having little effect, or you may overdose the patient by administering too much of the drug. The overdose may potentially cause serious harm. Also, do not administer drugs that are expired. The drug expires on the first day of the month listed unless otherwise specified. Once the drug is expired, it doesn't typically change its composition, but weakens in strength and its effectiveness in achieving the desired action. Once you administer the medication, you must document the drug, the dose of the medication, the route that you gave it, and time the medication was administered. Report any changes in the patient's condition and report whether the signs or symptoms have been relieved. Also report any deterioration in the patient's condition or if side effects associated with the drug have occurred. You then have to reassess the patient after medication administration. During the reassessment, assess the adequacy of any other care that has been administered to manage the patient's condition. Based on the care provided, determine whether improvement or deterioration in the patient's condition has occurred, and then document any improvement or deterioration. Be prepared to re-administer Narcan in the known or suspected opioid overdose patient if there is no response to the initial dose was not enough to adequately reverse any respiratory depression or hypotension, or the patient's mental status deteriorates and any respiratory depression and or hypotension recurs. You also want to look for any side effects that the patient may have had, their changes managed to their O2 sat, and any change in their condition. There are many sources that are available to provide additional information about medications. You always want to use a reliable source of information such as these listed here. One that we commonly use would be Poison Control. I would recommend saving this number in your phones once you get out into the field. So that way, once you start working, if you do come to a patient who has been poisoned or taken an unknown substance, you can contact them and they can help you out. There are also pocket drug reference guides that you can carry around with you. The package inserts. The physician's desk reference is a good one, but I don't foresee any of y'all carrying them because they're about the size of your textbook. Hippocrates would be a good one. Your cell phones, now that everyone pretty much carries a phone, you can download some of these onto your phone. And then any websites that your medical director has approved. And then also your medical director, if you need help trying to figure out a medication, contact them. They can help you out also. Alright guys, that's it for today. Make sure that you do your Brady Labs. And if y'all have any questions, just shoot me a message in Remind or in Blackboard. Otherwise, I will see y'all next time in class.